We welcome to the program now Mississippi State Senator Chad McMahan. He represents District 6, serves as the chair of Local and Private Senate Committee and vice chair Business and Financial Institutions over there in the Senate. Of course, we don't know where that's going in the next term, but welcome to the program, Senator Chad McMahan.
Thank you so much. It's great to be here with you. Merry Christmas to you and to all Mississippi.
Absolutely. Appreciate you coming on. So we wanted to get you on to talk about what is on the radar with respect to legislative priorities as we're getting close to a new legislative session. In fact, we're inside a month now till we convene. We've got a returning lieutenant governor, going to have a new Speaker of the House, a returning governor. I think mostly the same faces in both chambers will be around. What are you expecting? What are you going to be working on?
Well, what's important to the district that I represent is health care. As you know, the largest rural hospital in America in the United States is in Tupelo, Mississippi. So there's a lot of healthcare professionals in this area. A lot of our economy hinges around healthcare and what's taking place in the healthcare industry. That's a priority for me. As well as there are some local and private issues before each of the cities that I represent that we want to see some legislation and some projects brought forward. So okay. I'm not working on a lot of general. I'm not working on a lot of general bills at this time, but I'm working on things that are important to the people and the residents of the 6th District.
Senator, with respect to health care, do you have some specific measures you're thinking about introducing? Or have you talked to other members of the Senate that have some plans as well? What are you thinking there?
Well, I think that the season is right for some health care reform in this state. I think it needs to take place. We need 3 different approaches to health care reform. One of those needs to be, we need to give the people of Mississippi the opportunity to look at what the possibility of Medicaid expansion might look like for working Mississippians. I think we need some insurance reform. Insurance companies need to pay the providers in a timely manner. And if there's a dispute on an invoice, they can partial pay and then decide later about the balance of those invoices. I think we also need some pricing reform. When you go into a healthcare facility, there ought to be a menu printed, some type of cafeteria menu, so people know what procedures will cost them and their families, and so that they can make good financial decisions for their family. And I understand those price guidance. It's just a price guidance, and it's going to change annually. But I think that we need overall, we need to modernize our healthcare system in Mississippi.
Okay, and of course the price transparency issue, as you're well aware, is something that has been discussed extensively at the federal level, and there were some reforms implemented. I think it probably falls short of what you're talking about, but that is something that has been discussed quite a bit. It is a source of frustration for people. If you work with your primary care doctor and you have some sort of ailment that requires you to have a surgical procedure, for example, you call the hospital that's going to be doing that, they can't tell you what it's going to cost, honestly. They don't really know. It's a very complex process.
That's correct, and it was really brought to my attention that I had an accident, had to go get some stitches, and I got ready to pay. When I got ready to leave, I was just going to pay. And the healthcare facility that I went to said that they couldn't take payment, that they would have to invoice me. And I was like, well, how much is it? And they were, we don't have any idea. So there just needs to be some pricing guidance. And there are some privately held clinics in the state that do offer a menu or a cafeteria plan of what things cost when you go into their offices. But I just think there needs to be more transparency, and that we need some type of pricing rate card so that Mississippians and Americans know what something's going to cost.
Gotcha. Yeah, you mentioned Medicaid expansion. Of course, that has been available for about 10 years now under the Affordable Care Act. In fact, I think 2024 would be the 10-year mark. Mississippi is one of 10 states which has not expanded Medicaid as provided for under the Act. And the votes just haven't seemed to have been there, and there's been really some pushback, obviously, from Governor Reeves. Do you think the attitudes are changing toward that now, Senator?
Well, I'm neither for nor against Medicaid expansion. What I'm for is having hearings on it, and bring in professionals, bring in Mississippians that have health care, some that don't have health care, bring in professionals from across the state. Let's look at what modernization of Medicaid would look like. I also want to put in some mechanisms to detect Medicaid fraud and go after individuals and companies that are committing Medicaid fraud. We know there's some Medicaid fraud taking place, but ultimately, I'd like to see it. And I had a bill last year to put it on the ballot. I'd like to see the people of Mississippi have a non-binding vote on whether or not the people would like to see Medicaid expanded. And of course, then we would have some clear direction. We would have some clear direction on what the people of Mississippi want, and that could be put on the ballot next year if we could get it through the legislature. But look,
Interesting.
everybody's for, yeah. And so I think that's two different mechanisms to address it. I do think we need to have hearings, and then let's put it on the ballot and give the people opportunity to vote on it. I think it'll pass overwhelmingly.
Yeah, I mean, some third-party polls by private organizations indicate the same. That it, I mean, you get virtually all Democrats and a good portion of Republicans. That typically the poll results are in the 60% for it.
Well, Gerard, I don't think it's. Look, I don't want to politicize health care. Okay,
Yeah.
everybody's going to access the healthcare system at some time in their life. And it's not a Democrat, a Republican, or an independent issue. It's modernizing the system to perform best for all Mississippians. That's what I'm for. And I don't want to do what's good for the Republican Party or what's good for a Democrat Party or good for independents or for another party. I want to do what's right for the people of Mississippi and give them a voice in it. And let's look at what modernization of the healthcare system would look like. And it's not a one solution fix. I think you've got to bring insurance companies to the table. We need price transparency, and we need Medicaid modernization.
Okay, gotcha. What do you think about reinstatement of the citizen ballot initiative?
I'm for that. I want to have a ballot initiative that's fair, that so the people of Mississippi have a voice.
Okay. You're well aware the last couple of sessions we've been unable to reach a consensus between the houses to get a bill to the governor's desk. Largely, the dispute there is on the number of signatures required to validate a measure. So, do you think that there's an appetite to perhaps meet in the middle on that?
I'm for an initiative. I'm for restoring the initiative. I'm going to vote for the initiative once I see a bill, and I think the people of Mississippi need a voice. I would like to see it to be statutory and not something that goes in the Constitution, but I'll have to see what's before me before I can vote on it. But I do support the initiative for Mississippians.
Something that we've talked a lot about on the program here, Senator, is the public employees retirement system. I wrote a fairly extensive article on it about a month ago. Not sure if you happen to catch that. It's published on the SuperTalk site. I think it's something that's got to be addressed. What do you think is going to happen there?
The PERS board is an elected board. I think we need to have a hearing, and they need to come before a Senate hearing. I serve on the peer committee. This is something that's important to me. It's important to the peer committee, but I think we need to have some open hearings about where we are on the public employees retirement system. And that those elected officials on that board that represent the Mississippi employees and the retirees, we need to hear from them and hear what their plan is to make PERS solvent.
Gotcha. The governor seems to indicate that elimination of the income tax is his top priority. You think that's going to get some attention again?
I would like to eliminate the income tax, but I'm not willing to eliminate the income tax and replace it with a property tax or a higher sales tax. So if we can find a way to make it palatable where we're really going to cut taxes and not transfer it, then I'm for that. But I do want to find a way to eliminate the income tax. And for me, it's about being competitive with the surrounding states. We want to attract companies and families to Mississippi. Mississippi's a great place to live. We have one of the greatest highway systems in the state, in the country. I think we're ranked in the top 20 for highway systems. We have good weather pretty much year round. Property taxes are low here for the most part. The tax burden in Mississippi is fairly low on individuals. We have a lot to offer. We have some of the most competitive real estate prices in the country. We've got some of the best Division I schools in the entire
We got
country,
to
and
go,
we want to
Senator, but
attract people to.
I hear
Okay,
you. Appreciate it. Thank you a lot, Senator. We'll talk to you soon. Thank you.
appreciate you. Thank you.